Hi y'all, Dr. Fox again. Let's talk about the inferior vena cava and its tributaries. In this video, we'll describe the position and major tributaries of the inferior vena cava and also explain the regions drained by its tributaries. So the inferior vena cava is the conduit of blood return for all tissues inferior to the diaphragm. This blood is delivered to the right atrium, which is also the destination for blood from the superior vena cava. So both vena cavae drain their blood into the sinus venerum of the right atrium. In ascending to the heart, the vena cava travels through the diaphragm through an opening called the vena caval hiatus. And this is at the approximate vertebral level of T8. So the three hiatuses for the diaphragm are the caval, which is the highest at T8, the esophageal, which is at T10, and the aortic, which is at T12. Now, when we look at the pattern of return through the inferior vena cava, we see that the veins roughly mirror the arteries that branch off of the aorta. The major exception is that there are no veins reflecting the anterior visceral branches. So, for instance, there's no celiac vein. There's no superior mesenteric vein going into the inferior vena cava. There's no inferior mesenteric vein going into the inferior vena cava. The blood delivered by these major trunks to the viscera is part of the hepatic portal system. And so it won't be seen returning to the vena cava until after it passes through the liver. And then from the liver, hepatic veins will deliver that blood back to the vena cava. The vena cava is found right lateral to the abdominal aorta. So looking at this, the abdominal aorta would be over here. There are also, if you notice, some asymmetries with respect to veins on the left versus the right. And most of these are going to involve this left renal vein, which we'll discuss. So the left renal vein, and we'll outline the IVC here. There's the IVC. There's a very short right renal vein, and there's a very long left renal vein. And we can see that this is transected by the SMA. So it goes over it. That left renal vein is very long, and it has several tributaries. Namely, it is going to receive blood from the left gonadal vein, and on the right side, that blood goes directly into the IVC. It also is going to receive blood via common trunk from the inferior diaphragm and from the suprarenal gland. So there's blood from that left hemidiaphragm, left suprarenal gland, and left gonadal vein that all joins blood from the left kidney in returning to the IVC. On the right-hand side, all of those tributaries directly feed into the inferior vena cava. Now, the start of the inferior vena cava is much like the terminus of the abdominal aorta. So recall, the abdominal aorta divides into the common iliac arteries. Well, what we have here is the inferior vena cava as the union of the common iliac veins. And those common iliac veins have the same general pattern of tributaries that the common iliac artery has in terms of its branches. Namely, there is an internal iliac vein and an external iliac vein. That external iliac vein comes from the lower limb, namely the femoral vein, which we see in the femoral triangle. The boundary between the two is the inguinal ligament. So the inguinal ligament is the boundary between external iliac artery and veins and femoral artery and veins. Now, with respect to the lower limbs, just like the upper limbs, we have both superficial and deep sets of veins. Let's start with the superficial. Now veins we know to be inconstant, but there is a general pattern of signal here to discover. We'll start with blood being drained from the foot, and it's drained via two veins, a greater saphenous vein and a small or lesser saphenous vein. The greater saphenous vein drains the medial foot. The lesser saphenous vein drains the lateral foot. And the greater saphenous vein is very closely related to the medial malleolus. Very constant relationship there. And what it will do is ascend the medial aspect of the lower limb, and it will drain into the femoral vein within the femoral triangle. The small saphenous vein ascends laterally on the leg, and now let's go to the posterior view here, where it is going to join the popliteal vein within the popliteal fossa. Now, all of the deep veins are venae comitantes of the arteries that you come to know and love. So just like there's a posterior tibial artery that you're responsible for knowing, there are posterior tibial veins. Just like there is a popliteal artery, there are popliteal veins. Just like there is a femoral artery, there is a femoral vein. So that pattern holds just the same as the upper limb. Now let's assess our knowledge. Which structure's venous pathway includes the left renal vein? Let's see. A, left gonad, sounding good so far. Left inferior surface of the diaphragm, sounding good. Left kidney, yes. And left suprarenal gland, yes. All of those are correct. B, left inferior surface of diaphragm, sounding good. Left kidney, yes. And liver, wrong. C, spleen, wrong. D, spleen, wrong. Correct answer is A, left gonad, left inferior surface of diaphragm, kidney, and suprarenal gland, all part of the left renal vein return of blood to the IVC. Thanks so much for your time, and I look forward to talking to you in the next video. Bye.